Hi, I'm Troy Sebo, and today we're going to do cranial nerves 1 through 12 test. Today is 2/18/2017. We're going to start with cranial nerve 1. Can I have you close one nostril and take a deep breath in and out? Okay, can you switch nostrils and take a deep breath in and out? Okay, can you close your eyes? Can you cover one nostril? Okay, can you take a deep breath and out? Could you smell that? Okay, can you switch nostrils? Can you take a deep breath in and out? Okay, could you smell that? Did you know what the smell was?
Coffee.
Was it equal intensity on both sides? Okay. Now we're going to go to cranial nerve 2 test, which is the fundoscope. In this test, I'm going to be looking for AV nicking, hemorrhages, and palpal edema. Okay. So here I'm looking for AV nicking, hemorrhages, and palpal edema. AV nicking, hemorrhages, and palpable edema, which I found none of. Now we're going to continue cranial nerve 2 and 3. Continue with cranial nerve 2 peripheral test. Can you stare at my sternum? I'm going to use my hands and give you a symbol of either 1, 2, or 5. Just tell me what numbers you see, okay? Can you cover one eye for me?
1, 5, 5, 5, 1, 5.
Good. Can you switch eyes for me?
1, 5, 5, 1, 5.
Good. All right, now I'm going to continue with cranial nerve 2 and 3 by doing direct and consensual pupillary constriction, and I'm looking for a lack of constriction. First I'm going to do direct. Okay, and then consensual. Good. Constriction of both eyes is normal. Constriction. And this was direct. And that's consensual. Sorry, I'm burning your eye. Now we're going to move on to pupillary fatigue. Looking for fluttering as an abnormality. Good. No fluttering. Good, no fluttering. Okay, now I'm going to continue on cranial nerve 3. I'm going to look for patellosis or lid lag. No. Can you close your eyes? I'm looking for blepharospasms. And I'm also going to do accommodation and convergence. Can you look at my finger and follow my finger? Look at my finger. Can you see the light switch behind me? Okay, look at my finger. Look at the light switch. Look at my finger. Look at the light switch. Look at my finger. Look at the light switch. Perfect. All right, now we're going to do cranial nerves 3, 4, and 6. Field of gaze, H in space, and the X. I'm looking for fatigue, saccades, and end-stage nystagmus. Can you follow my finger? Good. Now I'm going to do the X. Good. Once again, I'm looking for fatigue, saccades, and end-stage nystagmus. Now I'm going to do cranial nerve 5. Can you put your hand out for me? I'm going to use that on your face. Are you okay with that? Tell me if you feel this the same intensity all the way through. Same intensity all the way through. Same intensity all the way through. Same intensity both sides. Same intensity all the way through. Same intensity all the way through. Same intensity on both sides. Same intensity all the way through. Same intensity all the way through. Same intensity on both sides. Good. Okay. Same intensity all the way through. Same intensity all the way through, same intensity both sides. Same intensity all the way through, same intensity all the way through, same intensity both sides. Same intensity all the way through, same intensity all the way through, same intensity both sides. Okay, that was a lot of questions. All right, now we're going to look at muscles of mastication, which is continued of CN5. Can I have you squeeze your jaw together? That's for the masseter. Once again, for temporalis. Good. And open your jaw. Perfect. Now we're going to move on to cranial nerve 7, which is going to be all motor that we're going to test. Can you raise your eyebrows? Can you close your eyelids tightly for me? Puff your cheeks. Can you smile? What's the funniest thing we did in boards? Okay, good. All right, now we're going to do hearing test. Cranial nerve 8. I'm going to do a finger friction rub. Close your eyes for me. Can you hear that?
Mm-hmm.
Tell me when you no longer hear this.
There.
Good. You hear that?
Mm-hmm.
Tell me when you can no longer hear this.
There.
Good. Now we're going to do Weber test. You hear that?
Mm-hmm.
Is it louder in one ear?
Left.
Okay. Now we're going to do Renee test. Tell me when you can no longer hear this.
Okay.
Can you still hear that?
Mm-hmm.
Okay. So because air conduction was longer than bone conduction in your left ear would indicate a sensory neural loss in the right ear. If bone conduction was greater than air conduction in the left ear, that would indicate a conduction loss in the left ear. Okay. We're going to, oh, did you open this? Tandem gait. Perfect. I forgot that. Can I have you get up for me? Can I have you walk heel to toe with your eyes open here? Okay, good. Now let's go back to the beginning. Now you're going to do that with your eyes closed. Okay, good. Thank you. Can I have you go sit down? Okay. I was looking for resting nystagmus. Yes, I'm going to continue on. Cranial nerve 12. I'm looking for atrophy and fasciculations of the tongue. And if I ask the patient to protrude their tongue and it deviates to one side or the other, it's going to be deviating to the side of the lead. Can I have you open your mouth? Can you stick your tongue out? Okay. Can you, oh, I'm going to grab the light, sorry. Okay, open your mouth. Okay, stick your tongue out. Okay, I'm going to have you say, open your mouth. Say, stick your tongue out. Say ah, 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 ah. Okay, I'm also going to do, so can you touch your tongue to my left hand, right? Good. Perfect. I did palate elevation, which was cranial nerve 9. Continue with cranial nerve 10, gag test. Can you open your mouth? Good gag. Okay, and bilateral tap SCMs. Can I have you raise your shoulders? All right. Can you turn your head to the right? Turn your head to the left. That's all 12 cranial nerves.